So what is insomnia? Insomnia is a common sleep disorder in which people have trouble falling asleep, staying asleep, or a bit of both. And as a result, they get too little sleep or poor quality sleep. Additionally, those who have insomnia typically do not feel refreshed when they wake up. Most of you can identify with this description of insomnia. We've all had periods where we've had difficulty falling asleep, maybe due to distress, anxiety, or even excitement. However, when discussing insomnia, it's critical to differentiate between short-term insomnia and long-term or chronic insomnia. Short-term insomnia, or what they call transient insomnia. Around half of all people will experience short-term insomnia in any single year. And this kind of insomnia usually lasts from a few days to a few weeks and is typically brought on by an event which causes distress. For example, many people here in Ireland may remember getting shorter and lighter sleep before an important event such as your leaving cert. Remember that? And these kind of reactions are the body's standard response to a stressful situation. And folks, these are normal and they are healthy. Evidence suggests that these periods of elevated anxiety within reason now may help also improve cognitive performance. And during this time, the need for sleep builds up, which will help bring on sleep to normal levels when the stressful periods subside. Okay? So put simply, most short-term insomnia is a temporary cyclical process which will pass with time. During these periods, you shouldn't worry about the lack of sleep you're getting. Use the extra time to prepare for the problems that are bringing on stress in the first place. If you focus too much on this interruption, you will find yourself spending too much time in bed worrying about your sleep. Worrying will most likely result in more anxiety and frustration and ultimately distract you from more important matters. Long-term insomnia or chronic insomnia. If you're having trouble getting to sleep or staying asleep more than 3 nights a week for more than 3 months, it's considered chronic or long-term insomnia. Now, long-term insomnia is much more severe than short-term insomnia and can lead to a whole array of adverse effects which will interfere with your daily life. Now, typical symptoms of long-term insomnia may include trouble falling asleep, waking up during the night, trouble staying or returning to sleep, waking up too early, daytime grogginess, never feeling rested after a night's sleep, irritability, mood changes, difficulty concentrating, memory problems, and increase in mistakes and accidents. It is important to note that psychological factors are not the sole cause for sleeping problems. For example, a poor bedroom environment, a cheap mattress, a bad pillow, thin curtains, wrong temperature, etc., can all significantly hinder your sleep. However, these factors, if not addressed, will probably become psychological triggers, preventing sleep and spiral in the same process as I just described. Kinds of insomnia. To properly deal with insomnia, it is vital to understand the kind of insomnia you may be experiencing. For example, middle of the night insomnia, as the name suggests, this kind of insomnia affects people who have trouble staying asleep. This could mean that you have experienced multiple wakings during the night, or it could be one long period where you just can't get back to sleep. And getting up in the middle of the night could be part of a natural sleep cycle, something they call biphasic sleep. However, if the awakening results in you feeling daytime tiredness and grogginess, this kind of insomnia could be the blame. Delayed sleep phase insomnia. This kind of insomnia means you have difficulty falling asleep. Typically, delayed sleep phase insomnia occurs due to some sort of interruption to your biological sleep clock. And to understand what may be interrupting your biological clock, you may need to record what you do hours before you go to sleep. Some potential causes may include psychological triggers, as we already discussed, but it could have something to do with your sleeping environment or a pre-sleep activity. For example, I had a patient once who had difficulty getting to sleep and staying asleep, and we found out through her case history that she ran every night before going to bed, and this was easily corrected by changing her exercise schedule to early in the morning instead of late in the evening. Early morning awakening insomnia. This means waking up early in the morning and being unable to fall back to sleep. An example of this would be if you wake up, let's say, between 3 and 5 a.m., and you're unable to get sufficient sleep. And this is quite common, something that's been reported to me oftenly by my patients over the past 25 years. Can't figure out which kind you have. With so many factors contributing to insomnia, it can be challenging identifying if you're suffering from sleep deprivation and what kind of insomnia you may have. The only way to truly understand is through trial and error, and by removing negative factors and observing how your sleep is affected, we can then begin to get a real comprehension of your sleep. So now I'm going to discuss the primary ways to deal with insomnia. Creating the perfect sleep environment. Your sleep environment is probably the most important factor in getting a refreshing night's sleep. Over 1/3 of your life is spent in the bedroom, and if you don't get that third right, the other 2/3, you might as well throw those away as well. However, many people still overlook the importance of how much a good bedroom contributes to a great sleep. If your sleep is important to you, it's vital to understand exactly how your bedroom impacts your sleep and how we can improve it. Get the right sleeping equipment. About 9 in 10 rated that having a comfortable mattress, 92%, and a comfortable pillow, 91%, are important for getting a good night's sleep. This means it's by far the most important element for sleep. And if you don't get your mattress and your pillow right, you can be sure it will significantly affect your sleep. If you only want to make one change, get your mattress and pillow right, and it will put you way ahead of the curve. Clean out all the clutter. Your bedroom should be your oasis and reserved for sleep, and sleep alone. Using your bedroom for other activities leads to your brain associating your room with these other things. This means you need to change how you think about your bedroom. A good start would involve making sure not to have your computer, your desk, your phone, or television in your bedroom. Cool temperature. I've mentioned this before. It's so simple yet important. Most sleep experts suggest that keeping your room just a few degrees lower than your average daytime temperature is perfect for sleep. I hope this video helps if you're suffering from insomnia. If you do know somebody who is suffering with this condition, please pass this video on to them, and thank you for watching, and don't forget to like and subscribe, and I'll see you at the next video.